Dr. Amesh Adalja, who is a senior scholar and assistant adjunct professor at the Johns Hopkins Center for Health Study. Welcome to you. Very good to have you on the program. Obviously, a terrible milestone in this current Ebola outbreak. Talk to us about the state of the outbreak, and also with regards to the speed with which Ebola now appears to be spreading. Can you catch up with something like that? Can you get on the front foot?
It's going to be very challenging to catch up to this outbreak because, as you know, this outbreak had at least several weeks to maybe months of a head start. This is caused by a rare species of Ebola, one in which the routine tests don't pick it up. And it's occurring in a part of the world where there is so much mistrust that we're having a very hard time doing the basic public health measures that we know stop Ebola outbreaks, such as contact tracing. They're unable to figure out these chains of transmission. Many people are dying in the community, which means they're not known to public health authorities, and there are massive lacks of personal protective equipment. So this is going to be something that takes maybe a year or so to get a handle on. And I think this is really going to put every system to the test to be able to stop this outbreak.
You mentioned there the mistrust on the ground. We know that in some parts, an area where there is conflict, making it all the harder to get in. But when you talk about things like PPE, personal protective equipment, can more be done there? Also in terms of scaling up the international response, is it sufficient?
There is more that can be done in terms of getting personal protective equipment, creating Ebola treatment units, increasing the ability to test. And then most importantly, I think, is to get personnel into the outbreak zone to be able to execute those actions. And unfortunately, some of the travel policies, including of the United States, have really disincentivized some of our best resources from going there because they don't want to be stuck in limbo like you just talked about with those individuals from New York that were put into a quarantine. So this is something that is perpetually a challenge, is that you need to get resources into the outbreak. But then you have politicians that are afraid of any kind of exportation of a case, so they make it paradoxically harder to do that by restricting travel into and out of the outbreak zone. So that's been a major challenge, is trying to combat that tendency of policymakers, including the U.S. president, to not allow people to easily go into and out of that outbreak zone, even if they're healthcare workers.
You mentioned those travel bans. I mean, currently we've seen the situation where there are 7 American aid workers. They were in the Democratic Republic of Congo. They're being quarantined instead at a US facility, which is being created in Kenya, as opposed to coming back to the US. How much of a departure is that from what we saw in 2014 in West Africa, for example? It's
a complete 180-degree departure from what we saw during the 2014-2016 outbreak. During that time in the United States, we treated multiple patients, multiple healthcare workers who got infected in West Africa and were treated safely at places like the NIH and Emory in Nebraska. There is a whole system in the United States to take care of these high-consequence infectious diseases expertly and safely. And that they're sitting fallow right now. These were built at taxpayer expense, but nobody is using them. And when we've had 2 Americans get ill, they were treated in Germany. That doesn't make sense. And it really is completely the opposite of the resiliency that we created in this country after the 2014-2016 outbreak.
Coming back to the picture on the ground in DRC, is there the potential with what we're seeing right now? And we know that, suspected cases aren't currently being reported. Is there the potential that we could see an outbreak that is worse than what we saw in 2014, which was utterly devastating?
If you look at the slope of cases, the slope of deaths, this is on pace to eclipse the 2014-2016 outbreak if it continues at the pace that it's on. That doesn't mean that the fortune is already kind of told. There are ways to interrupt this chain of transmission if resources are there. This is right now the 3rd biggest Ebola outbreak in history. It's likely to become the 2nd soon, but we can prevent it from becoming the worst if we actually do what we know we need to do to extinguish this Ebola outbreak. It's going to be challenging. Misinformation, the militias that control that part of the DRC are going to be hard to contend with. But I think it is possible if the world actually puts their resources to the task.
Dr. Amesh Adalja there, senior scholar and assistant adjunct professor at Johns Hopkins Center for Health Security. Really good to talk to you. Thank you.